When people hear the word dementia, it's easy to jump to conclusions about what it is and what happens. The best way of understanding dementia is to focus on the key symptoms. The word dementia describes a set of symptoms that may include memory loss, difficulties thinking, problem solving, speech, or language difficulties. These changes are often small to start with, but for someone with dementia, they become severe enough to affect their everyday life. A person with dementia may also experience change in their moods and behaviors. Specific symptoms that someone with dementia can experience will depend on the parts of the brain that is being damaged and the type of disease that is causing the dementia. Dementia isn't a specific disease. Instead, dementia describes a group of symptoms affecting memory, thinking, and social abilities that are severe enough to affect daily functioning. What are some of the causes, symptoms, diagnosis, and treatments of dementia? To start off, we will talk about the causes of dementia. Dementia is caused by damage to the brain cells. The damage interferes with the ability of the brain cells to communicate with each other. When the brain cells cannot communicate normally, thinking, behavior, and feelings can be affected, according to the Alzheimer's Association. I kind of look at it as it's a heart attack in the brain. When the receptors are being damaged, it's kind of like a heart attack when your arteries are clogged, except your brain, the nerves in your brain and your receptors are being clogged, so it's hard for them to intercept information that goes back and forth. According to the Mayo Clinic, having a family history of dementia puts you at a greater risk of developing dementia. However, many people with a family history never develop symptoms at all, and many people without family history do. There are tests to determine whether or not you have certain genetic mutations that could cause dementia. Next, we'll move on to what are some of the symptoms of dementia. According to BetterHealth.com, although early signs vary, common early symptoms of dementia include memory problems, particularly remember recent events, and increasing confusion, reduced concentration, personality or behavior changes, and withdrawal or depression. And then you have the loss of ability to do your everyday tasks. It's normal to occasionally forget appointments and remember them later. A person with dementia may forget things more often or not remember them at all. People can get distracted and they may forget to serve part of a meal, for example. A person with dementia may have trouble with all the steps involved in preparing a meal. Everyone has trouble finding the right words sometimes, but a person with dementia may forget simple words or substitute the wrong words that make sentences difficult to understand. They may also have trouble understanding others. Diagnosis, according to the book of Harvard Medical School, to diagnose dementia, a doctor looks to see if a person's memory gets progressively worse, along with one of the following: difficulty understanding or using language, the inability to perform purposeful or sequence of motor activities. Some of the treatments that are available, according to the Center for Gerontology at Virginia Tech, there are none. Unfortunately, there is no current cure for dementia. There are several medications available to help treat the symptoms of dementia. Some medications attempt to improve the brain's functioning and slow the progression of the symptoms. Others may be prescribed to help with mood, psychosis, sleeping problems, wandering. Several non-prescription drug treatments may also be a benefit to a person with dementia. So in conclusion, what does dementia mean to those suffering and diagnosed with it? Dementia is a disease that can bring grief to a family if it isn't handled correctly. There are so many myths circulating about the illness, and many people do not understand that dementia is a manageable condition. In fact, many families living with dementia patients can find some peace and little stability. It just takes a clear understanding of what dementia is and how it can be managed. Everyone must realize that dementia is a symptom of another more complex disease or disorder. It isn't contagious, and you can't just come down with it like a cold. There is always something else that leads to dementia. We've discussed causes, symptoms, diagnosis, and treatments of dementia. Now that you know a little bit more on dementia, what does it mean to you, and will there ever be a cure?